In my previous video, I talked about how I would use all three of these products to try to help reduce the pain in my big toe and try to help improve the alignment of my big toe if I was diagnosed with a bunion. In this video, it's going to be a continuation of that, but I'm going to focus on presenting why the big toe moves out of alignment and gets closer to the rest of the toes. And then I want to present the best conservative treatment that research suggests, and then give you exercise at the end. I'm going in this order because I do genuinely believe that having a good understanding of what is happening and then knowing the best research out there will be helpful for you, and it will give you an idea of what we're going for with the exercises. However, if you don't care for this stuff, you can definitely skip to just the exercises and I can give you a timestamp for that. But I would encourage you to try to develop a basic understanding of what's happening. Okay, so let's talk about the cause. We really don't have a great understanding. However, we think it's a multitude of factors. The first factor being that it can be a genetic factor. You're just maybe predisposed, and you can look at your parents or grandparents' toes to see if they've developed a bunion, and that may give you a good idea that you may be more prevalent to developing it if you haven't developed it already. The second factor is that biomechanically, sometimes the heel bone isn't moving with the way it should in terms of helping you control the arch of your foot, and because it's not controlled there, it can actually influence how the big toe moves and eventually cause you to develop a bunion. The third factor is that, again, back to the genetics in a sense, where females are just more prevalent to developing in males. We know that as you get older, you just become more prevalent to developing a bunion as well. So, I think that's the best understanding that we have in terms of why a bunion occurs. Contrary to popular beliefs, tight shoes are not the main cause of a bunion. I don't think there's a research out there that definitely points to that. However, we do know that it definitely doesn't help it, and it contributes to it if you are already predisposed to developing a bunion. So that's something that you can keep in mind. Okay, now the research behind the best conservative treatment. So the best conservative treatments are really a combination of a few factors. Dry needling is one, especially if your pain is acute. In combination with dry needling are using toe spacers, and then in combination with that are the exercises. Those are really the best conservative treatments, and the best result seems to come from a combination of doing all three. Okay, so with the exercises, so if you're doing the exercises to help improve or rather to help reduce your pain, definitely go for it, and especially in combination of using the toe spacers and dry needling. If you're doing the exercises in hopes to correct the alignment of the big toe, I would encourage you to definitely pursue that, especially again with a combination of wearing the toe spacers. However, you need to realize that this will be a very long journey for you. The reason why I say that is because there is not really good evidence out there that says that wearing toe spacers will help improve the alignment of the big toe. With that said, most of this research also were performed within a small span in terms of 3 months and 6 months follow-up, sometimes up to a year. And even with the research that did show an improvement in the alignment of the big toe, the improvement seems to be within a margin of error that it became inconclusive. However, I would definitely not discourage you from not trying it, but I would say that be realistic with yourself and realize that this would be a long-term journey for you. It might be a year, it might be a year and a half, or 2 years, again, depending on the degree to which your big toe has moved in towards the small toes. I do think it's worth trying though, because your big toe is actually very, very important in terms of your biomechanics, in terms of how you move. And the minute that you start to distribute weight off of the big toe to other areas, you change your whole chain reaction and you expose yourself to other joint injuries. So I would definitely encourage you to keep trying. Okay, so with all that out of the way, let's move on to the exercises. Okay, so with the toe spacer in your second toe and with a thicker section facing the big toe, that will align the big toe in a better position. And then from here, while sitting, I want you to just mentally try to move that big toe out towards your your other foot. So this might be hard for some of you, and actually this will be hard for most of you. And for some of you, you might not see the big toe move at all. That's okay. Part of this will be frustrating, but as you keep trying, you, especially within a week or two, you start to notice that you are developing better neuromuscular control to get that big toe to move a little bit. Okay, so after you've gotten pretty confident with the seated toe abductions or moving the big toe out to the side, you can move on to the second exercise that I would recommend, which is pretty much standing while keeping that big toe out to the side. Feel free to again do it with the one toe spacer on. If you don't have the one toe spacer, it's totally okay to do it without it as well. So standing, keeping that big toe out to the side as best as you can, and then keeping it there while shifting your pelvis or translating the pelvis and your whole trunk forward a little bit and backwards. So this is a great way to start to work on your balance and to start to build the foundation to go through a little bit more of functional exercise to try to incorporate that big toe to work as you transition from your heel to the big toe. Again, you want to do this for about 30 seconds, 30 to 40 seconds. Twice a day would be awesome. 3 times a day would be also better. The next thing that exercise that I would recommend rather, is single leg balance. Again, keeping that big toe out to the side while rotating towards this the stance foot. And this is a great way to, again, incorporate and functionally get the arches of your foot to work, help improve the function of your toe, get the heel bone to work optimally. So we try to reduce the chance of it contributing to the bunion as much as possible. I would definitely recommend shoes that have a wide toe box if you do have a bunion. So there are definitely more exercises that I can give you, but I think these are the core ones. As you get comfortable with the last exercise, definitely think about incorporating calf raises, think about incorporating more balancing drills while keeping the big toe out to the side in as many varied ways as possible. You can definitely add it into your exercises if you're an active person, especially if you're doing like single leg deadlift patterns. You can incorporate it right there by keeping the big toe out to the side and going through the deadlifting motions while standing on one leg. So those are all those little neat tricks that you can do to incorporate it into your own exercise routine if you're an active person. All right, so that will be it for the exercises. If you have any questions, feel free to comment down below. I'm trying to grow an awesome community here, so I would definitely appreciate feedback and questions, and if there's any topic that you would like me to cover. All right, I'll see you all in a few days.